Bismillahirrahmanirrahim. Assalamu alaikum. Today we're going to talk about the antifungal drugs affecting fungal cell membrane. Antifungal agents are used to treat fungal infections which are called mycoses. Treatment of fungal infections has been less successful than that of bacterial infections since fungi and humans are both eukaryotes and so they're much similar to each other as compared to bacteria which are prokaryotes. As a result, antifungal drugs can have toxic effects in humans. Moreover, fungal infections are becoming more frequent because of their role as opportunistic infections in immunosuppressed individuals, especially people with AIDS. We can categorize fungal infections as cutaneous infections, those responsible for infections of skin, hair, and nails, mucocutaneous infections causing infections of moist skin and mucous membrane, and systemic infections. Systemic infection is an infection that is present in the bloodstream and so it can be fatal. Systemic infections like pulmonary histoplasmosis or systemic candidiasis occur more commonly in immunocompromised patients. Let's talk about the agents affecting the fungal cell membrane. Many antifungal drugs target the sterols in the plasma membrane. The principal sterol in fungi is ergosterol, while in animals it is cholesterol. This structural difference in the cell membrane of fungi and humans make drugs like polyenes, azoles, and allylamines selectively toxic. Polyenes are the first group of drugs which we're going to discuss. They are produced by Streptomyces species and were discovered in the decade of 1950s. Nystatin, natamycin, and Amphotericin B belong to the group of polyene antibiotics, among which nystatin is the most commonly used member. It is used to treat oral thrush caused by Candida albicans. For systemic fungal infections such as histoplasmosis, blastomycosis, and coccidioidomycosis, Amphotericin B is used. Here we have the structure of polyenes. This is the structure of nystatin and this is the structure of Amphotericin B. So the mode of action. When polyenes are exposed to fungi, they bind to ergosterols present in the fungal membrane, which results in the development of pores within the fungal membrane through which ions like sodium, calcium, hydrogen or potassium can leak out, killing the cell. Since cell membrane of mammals also contains sterols, polyenes have a relatively low therapeutic index. Drugs with a low therapeutic index are drugs with small difference between their therapeutic and toxic doses, and so small changes in dosages or interactions with other drugs could cause adverse effects. Polyenes are found to have a broad spectrum, with majority of fungi being susceptible to very low concentrations. Yeasts like Candida species and Cryptococcus neoformans, filamentous fungi including Aspergillus species and Mucorales, and dimorphic fungi like Histoplasma, Blastomyces, Coccidioides, they lie in the spectrum of polyenes and they're found to be sensitive towards these antifungal inhibitors. Nystatin has been extensively used for treating Candida infections of the mucous membrane. Amphotericin B is used for systemic fungal infections like aspergillosis, cryptococcal meningitis, histoplasmosis, blastomycosis, and candidiasis. So the mechanism of resistance. One of the mechanisms by which resistant strains have developed resistance is by alteration in the lipid content of cell membrane, such that the concentration of ergosterol is depleted. Since ergosterol is the site of action for polyenes, its depletion decreases the drug affinity, making the drug inactive. Fungal strains also have acquired resistance by alteration in fungal cell wall. Modification in chitin and 1,3-glucanes, which constitute fungal cell wall, decreases drug permeability, which in turn leads to increased resistance. Polyenes are found to have certain interactions with other drugs. Drugs like flucytosine, minocycline, imidazole, and rifampicin are found to have synergistic effects with polyenes, while aminoglycosides, mineralocorticoids, cyclosporine, antineoplastic drugs, thiazide, and curorizing drugs are found to have antagonistic effects when used along with polyenes. These polyenes are found to exert certain adverse effects like fever, digestive disorders, headache, chills, or malaise. Thrombophlebitis, which is the inflammation of veins resulting in the blood clot formation, can also be a cause of polyene. Other than these, nephrotoxicity and anemia may also result with the use of polyenes. So azoles also belong to the group of antifungal inhibitors, and we'll talk about it next. Azoles are synthetic drugs that were discovered in the decade of 1970s. These azoles are divided in two major classes: imidazole, including drugs like ketoconazole, miconazole, or clotrimazole, and triazole, including fluconazole, itraconazole, or voriconazole. There are some drugs like thiazole, oxazole, and pyrazole which do not belong to either of these groups, and so they are placed separately. If we talk about the structure of azoles, we see that azoles are a class of 5-membered heterocyclic compound. Containing a nitrogen atom and at least one other carbon atom like nitrogen in imidazole, or it may have sulfur like in thiazole, or an oxygen like in oxazole. Miconazole belong to the group of imidazole. This is the structure of miconazole belonging to the group of imidazole, and here we have the structure of fluconazole which belong to the group of triazoles. The spectrum of activity of azoles. Azoles are used to treat fungal skin infections like ringworms, specifically Tinea pedis, commonly known as athlete's foot, Tinea cruris, the jock itch, and Tinea corporis, the body ringworm. These infections are commonly caused by dermatophytes of the genera Trichophyton, Epidermophyton, and Microsporum. Miconazole is used predominantly for the treatment of vaginal yeast infections caused by the fungus Candida, and ketoconazole is used for the treatment of tinea versicolor and dandruff, which both can be caused by the fungus Malassezia. If we talk about its mode of action, we see that azoles exert their action by inhibiting the action of the enzyme lanosterol 14-alpha demethylase. When it inhibit the action of this enzyme, it inhibits the demethylation of lanosterol, which interferes with the synthesis of the ergosterol in the fungal cell membrane. The resistant strains have developed resistance by gene mutation, altering the target enzyme lanosterol 14-alpha demethylase. As a result, the drug is no longer able to bind to the enzyme, and the drug thus becomes inactive. Gene mutation in resistant strains is also responsible for overproduction of the target enzyme, and this decreases competitive inhibition by the drug, as therapeutic doses are no longer enough to prevent ergosterol synthesis. Then development of efflux pumps are also a cause of resistance, as they decrease concentration of drug at target sites. The adverse effects, fluconazole is rarely found to cause any adverse effects, but may be a cause of nausea, abdominal discomfort, diarrhea, and headache. Liver toxicity and Stevens-Johnson syndrome have also been reported with the use of fluconazole. Ketoconazole have been found to cause nausea, vomiting, abdominal pain, headache, rashes, urticaria, and pruritus, which is an itchy skin. And then ketoconazole can also cause fatal hepatic damage. Voriconazole have been found to cause visual disturbance and rashes. Other than these, rare side effects include life-threatening hepatitis by voriconazole. The third group of antifungal drugs which affect the cell membrane are the allylamines. They are synthetic compounds effective in the topical and oral treatment of dermatophycosis and superficial forms of candidiasis. Naphthene and terbinafine are two allylamines which are frequently used when resistance to azole type antifungals arises. Here we have the structure of allylamines, the terbinafine and the naphthene. If we talk about its spectrum of activity, we see that allylamines are only effective against dermatophytes used for the treatment of fungal infections of skin and nails. Terbinafine is used topically for the treatment of skin infections like athlete's foot and jock itch. It is active against a wide range of pathogenic fungi, including epidermophyton, microsporum, trichophyton species, Candida species, Aspergillus species, then Histoplasma capsulatum and Sporothrix schenki. Naphthene is used for the treatment of dermatophytosis, including Tinea pedis, Tinea corporis and Tinea cruris. These allylamines are fungicidal drugs which competitively inhibit squalene epoxidase, this enzyme, thus blocking the conversion of squalene to lanosterol, leading to squalene accumulation and ergosterol depletion in the cell membrane. Allylamines can cause adverse effects like abdominal discomfort, loss of appetite, nausea, diarrhea, headache, impairment of taste, rash and urticaria. Some serious skin infections like Stevens-Johnson syndrome and rare hepatotoxic reactions are also occasionally encountered, like jaundice, hepatitis and cholestasis. Cholestasis is a liver disease and it occurs when the flow of bile from liver is reduced and or blocked. So this was all about the antifungal agents that affect the fungal cell membrane. Thank you very much.